Corpbiz.
Indian medical device industry. Since the world has come to know about medical sciences, India has been amongst the pioneers, whether we talk about Ayurveda or allopathy. In recent decades, the healthcare and medical device industry have risen dramatically. There is a substantial gap between the current demand and supply of medical equipment in India, which presents a big potential for devices manufacturers in India. India is becoming an increasingly important market for medical device outsourcing. Over the last decade, the industry has experienced enormous growth opportunities, and current development trends promise even more potential in the coming years. The Indian medical device industry has been influenced by a number of joint ventures, agreements, and loan licensing procedures. During the pandemic, when even US and the other developed countries gave up, India kept fighting against it and came up with not just one vaccine but two and supplied it across the globe. Though we also lost many of our loved ones, but also saved millions. Hello everyone, this is Yash Saxena and you are watching Corpbiz. In this video, we are going to talk about the Indian medical industry and its future in the coming years. To understand all these scenarios related to the medical industry, one should know the market share India has in this particular sector globally. Encouragement of health-related innovation. Current market size for medical devices in India is estimated to reach $11 billion, making it a promising area for the Indian economy. Large global corporations and small medium-sized enterprises (SMEs) coexist in India's medical device industry, which is growing at an unprecedented rate. The Indian medical device industry is poised for tremendous growth with a market size of $50 billion predicted by 2025, growing at a CAGR of 15% over the previous 3 years. The automated mechanism allows for 100% foreign direct investment in both brownfield and greenfield projects. Strong FDI inflows shows international investors trust in the Indian market. India has a 75 to 80% import dependency on medical devices. Export stood at US $2.51 billion in 2019-20 and are expected to rise $10 billion in 2025. To increase export of medical devices in the country, the Indian Ministry of Health and Family Welfare and Central Drug Standard Control Organization (CDSCO) implemented the following initiatives: re-examination and implementation of Schedule M3, a draft guidance on good manufacturing practices and facility requirements, system for export labeling, clinical evaluation and adverse reporting clarification, state licensing authority to extend free sales certificate validity from 2 years to 5 years to allow exports, create a list of manufacturers with export licensing for easy access by the regulatory authorities worldwide. Despite present market issues, India's advantage in areas such as cheaper labor cost and high level of technical competence and government financing for R&D investment to speed new product development have made India one of the most attractive outsourced manufacturing locations. The industry is likely to expand more in the future years as more multinational corporations seek to tailor their goods to satisfy country-specific requirements. The newly announced the Drugs and Cosmetics Amendment Bill 2013 is intended to recognize medical devices, equipment, consumables, and diagnostic commodities as different. The separation of medical devices and drugs will result in a considerable decrease in the time it takes to approve or license medical devices. Indian medical device industry is predicted to grow at an unparalleled rate over the next decade. The industry is expected to be worth $50 billion by 2025. This is due to the rising middle class as well as growth in the number of hospitals and as a result a greater need of sophisticated medical gadgets and improved healthcare. Let's discuss in detail the key growth drivers for this industry. India's population is predicted to reach 1.45 billion by 2028, making it a most populous country on the planet. Life expectancy in India is expected to climb to 70 years by 2025, up from 67.5 years now. Non-communicable disease (NCDs) account for half of the illness burden and 60% of all fatalities in India. Preference shift, increased health information, a shift in attitudes towards preventive healthcare, and an increase in the prevalence of lifestyle problems are all contributing factors. 73 million Indian families will reach the middle class during the next 10 years, boosting their purchasing power, including in the field of medical devices. Increased disposable income by 2026, 8% of Indians will earn more than $12,000 per year. Health insurance, about 20% of Indians are covered by health insurance. With increased affluence and urbanization, this number is anticipated to rise. Medical tourism is on the rise in India because to the relatively low cost of medical care. It contributes more than $2 billion to India's healthcare market. Medical tourism has increased the demand for healthcare and medical devices. Infrastructure development. India is planning 4 medical devices park. Policy support and incentives. 100% FDI authorized in Greenfield and brownfield projects. Lower entry hurdles than other industries and varied and vibrant startup ecosystem. So, this was all about the topic, and for more information related to any license or registration, you can contact to our expert team. And for more such content, keep watching Corpbiz. This is Yash Saxena signing off. Thank you.